Hi, hello everyone. Hope everyone is fine. Today I'm discussing with you one dental implant case. If you're considering tooth replacement, this guide will help you in making an informed decision regarding the same. Why dental implants? Why dentition? Dentition, as you know, it's important for digestion. Our digestion starts in mouth only. If dentition is impaired, our digestion will be impaired. Why implants? Why not other treatment modalities like removable dentures, like fixed dentures? They have their own disadvantages. For fixed prosthetics, you have to go for reduction of your adjacent abutments, your teeth. So, as per implants are concerned, we don't have to do that. Implants take an advantage of the bone only. So, we are placing the fixture, titanium-based screw-shaped fixtures. We are placing it to the bone and letting them heal for 4 to 5 months. And after that, we are placing the prosthetic part. So as per this case is concerned, this patient landed in our hospital with the chief complaint of fracture of prosthesis. On clinical examination, there was periapical lesion in relation to canine and first premolar. So retreatment was initiated in relation to the same. Calcium hydroxide was placed in order there is resolution of the periapical infection, because there should not be any infection adjacent to the implants, because it would have negative consequences in the long term of implant stability. Crestal incision is given posterior to the premolar. After crestal incision, the flap is reflected. Pilot drill is used in order to locate exact osteotomy. After osteotomy is prepared, we are using guide pen to check angulation with the adjacent anatomical structures. Implant is fixed into the bone. After that, interrupted suture is placed so that primary closure is achieved. After primary closure, we are letting the patient to wait for 4 to 6 months at least. If it is lower arch, we will go for 3 months only. If it is posterior arch, that's less dense, we have to wait for 6 months at least. So after 4 to 5 months, we're checking the patient, taking CBCT to check osseointegration of the implant. Osseointegration is fine. So we are now in the second stage of implant placement. So second stage is we are using rubber-based healing caps in order to achieve proper emergence profile of the gingival. Proper emergence profile, why? Because emergence profile uses aesthetics. So it is essential we should have proper emergence profile for aesthetics. After that, we are using abutments to check its height, to check angulation, and we're taking in impressions, sending it to the lab. The final prosthesis is ready. We are fixing the final prosthesis. You can evaluate pre-on and post-on pictures of the patient. Have you ever considered a dental implant? What worries you the most about this procedure? It's not that expensive. It's not that painful. Thank you.